Again, Kenny, for the invitation, and thank you to the specialist group for allowing me to talk to you guys a little bit about one of my favorite animals. I mean, there's a lot of animals or species that are favorites, but I would say tamanduas are definitely in the top ones. So my name is Dr. Margarita Woc-Colburn. I'm currently at the Phoenix Zoo. I'm the Director of Animal Health. And then here in the US, because I know there's people from all around the world, I'm the Southern Tamandua SSP Veterinary Advisor, as well as one of the veterinary advisors for the PAX tag, so the pangolin, Xenarthra and armadillo tag. So today I want to present to you just a little bit about some of the medical challenges facing tamanduas. So it's going to be a little bit heavy on the veterinary, just some of the diseases and problems we see in these guys in captivity, particularly more in North America, because that's sort of where I've done some of the mortality surveys. So I'm very briefly going to be going just very brief review for everyone about a little bit about anatomy, and then just some of the preventative care we do on these guys. So tamanduas belong to the family Myrmecophagidae, which includes the giant anteater, the southern tamandua, and the northern tamandua. I would say here in North America, in zoo settings, at least in ACAs, we see more of the southern tamandua, and that's where the SSP is based. And the range goes from Mexico, Central, and South America. So for these guys, just general, very brief anatomy. The reason Xenarthrans are called Xenarthrans is that they have these Xenarthrans joints. There are these processes located between the lumbar vertebrae and the spinal column. They also have, interestingly enough, they have fused pelvis and ossified sternal ribs. And then they have very well developed front claws, as you can see in the giant anteaters and in the tamanduas. And that tends to be their main defense mechanism. They can dig with that, and then they can climb. They lack teeth, but they have this very long tongue with sticky saliva, and that tends to help them, get their termites and food from that. For us vets, when we're trying to get blood, we sometimes tend to hit the salivary glands because they have this large submaxillary salivary glands with a type of bladder. And then these guys walk on their knuckles. They have very poor sense of hearing and eyesight, but very good sense of smell. So for the tamanduas, as well as the giant anteaters, they have a very low basal metabolic rate. It's about 30% less than your typical mammal. And you tend to see this come into play when you're taking their body temperature, for example. They have a double posterior vena cava. And then for those of you guys that have anteaters and tamanduas, you sometimes see this white ocular discharge, and that for the most part tends to indicate some type of stress. Tamanduas have a very strong prehensile tail, and then their hair is not as coarse as the anteaters, for those who have gotten to touch tamanduas. They have also this reddish pigment, particularly around their underbelly. You see it a lot around the tail and everything. Sometimes people can think like it's blood when you see it on your hands, but it also has like a musky smell. And then their small intestine, I just like cool facts, they have 20 times the size of the colon. Let's see, there we go. So just general parameters for those vets. So their body weight is about 3 to 7 kilos. Body temperature, because of that low metabolic rate, is 32 to 34 Celsius. And then for those in the US, that's like 90-93 Fahrenheit. Heart rate is about 100 to 140, though I've sometimes seen them be a little bit higher if they're excited. Respiratory rate 18 to 26. So for your preventative medicine, I do tend to tell the vets to tailor it based on that risk of your facility and sort of the health of your collection. I usually tend to recommend doing exams 1 to 2 years, because these guys do tend to have problems throughout when they're juveniles, as well as when they're adults, and then also when they're older. And then I tend to say getting fecal ova and parasite exams every 6 months to a year. Obviously, again, that depends on where your Tamandua is being housed, what problems you see, what other health conditions they have. And then for blood work, about every 2 years, obviously more frequent if you're seeing problems. And then for radiographs, if you can do them every 2 to 3 years, it tends to help a lot for some of the medical problems you see. And then for your taurine levels, they are prone to sometimes dilated cardiomyopathy like the anteaters, though not as frequent, which is one of those differences between the two. And I tend to recommend doing that 2 to 3 years because you do need to tailor how much taurine you're giving them as supplement. And then antiparasitics based on more on what you're finding on your fecals. So for vaccinations, the core vaccine tends to be rabies vaccine. So these guys are susceptible to rabies. There's actually a recent article in the journal Zoo and Wildlife Medicine about a case of a tamandua with rabies. So here in the US, we sometimes have the canary pox or the MRAB3, and you can give it 1 to 3 years. It's off label, so we don't really have studies knowing the actual frequency. So I just say, do it like you do your dogs and cats. For the other ones, it's based more on the risk that you see in your collection in your geographical region. So at Nashville, we actually vaccinated for distemper because we did have the tamanduas could have contact with some of the wildlife. And then there was distemper that sometimes had outbreaks throughout there. And it is something that has been seen in giant anteaters, and tamanduas are most likely susceptible. Same thing for West Nile virus. If you're in a heavy mosquito area, it might be helpful. And then I know some institutions do vaccinate for Clostridium and tetanus based on the risk. So diagnostics, the fun part. So these guys, for drawing blood, just like other mammals, jugulars, though usually for me, for jugulars, it's looking at the point of the shoulder to sort of the edge of the mandible, tends to be a nice line. You sometimes might end up getting saliva, so you just need to like readjust. It's not something that's visible, and sometimes you can't really see it pop up because their skin is really thick. They also have a really good cephalic and medial saphenous vein. And then sometimes my favorite go-to is the ventral tail vein, just because when you're handling it, just sort of pops in there and it just tells you, go stick me. So for radiographs, you can just do the same views like you do your dogs and cats. Obviously, to do those lateral ones, you have to be restraining them. And some of these guys tend to be pretty wiggly and they're pretty strong too. Sometimes even getting creative. So in here, I have, this was one of our tamanduas, Felice, and we were doing a study with barium just to see how long it took to empty the stomach. We were trying to compare it with an abnormal tamandua, and she did a lot of stuff for yogurt. So she perfectly stood there, and we can do all the barium studies all day. This is also a great view if you're trying to get that radiograph to see if they're pregnant, particularly if they're in late-term pregnancy. So sometimes for these guys, you can get them creative. You can also train them. These guys are very good for training, and they're very food motivated for the most part. Ultrasound tends to be probably one of the things that I tended to do most often with these guys. It can be used for pregnancy detection, as well as being a really powerful tool in evaluating your cardiac for all those heart diseases we sometimes see in them, looking at the liver, looking for things with your intestines, as well as kidneys. These guys can be prone to kidney disease. And then you can also do endoscopy, obviously under anesthesia, for those that have your GI issues, because these guys can be prone to inflammatory bowel disease, where you might end up needing to get biopsies. And then you can do ultrasounds, whether they're fairly neonates or a little bit older. This again is Felice, again doing a lot with yogurt. So for your restraint, like I mentioned before, you can do behavioral restraint for these guys. The big thing is just make sure your hands are not getting trapped by those claws. They can do a lot of damage. So sometimes I recommend you can put boxing gloves, as you can see in that photo. Sometimes for handling in the previous photos, you could see the keepers, they have them so that they could hold that foot in a flex position, which help them restrain and keep themselves from getting clawed. There are some tamanduas that do not like to be handled for getting blood or anything, and you might need to do injectable anesthesia. Depending on the tamandua you have, you could do induction through face mask, like with isoflurane or sevoflurane, or you could use like your injectable anesthesias like you do in your giant anteaters, and that's usually a mix with ketamine mixed with an alpha-2 agonist, so your medetomidines, dexmedetomidines. You can add midazolam or butorphanol. Buprenorphine is particularly if you need pain relief. Sometimes you can use tilosol. And then I also think because of their size, you could also use sulfaxone. I haven't seen any published data, so I'll be really interested for those who have tried it. Like the giant anteaters, these guys are very difficult to intubate. A lot in the photo is that their glottis is way, I don't know if you guys can see the arrow, but it is way down here. So they have a very long snout, and then the base of the tongue is way down there. So that makes it challenging. Probably in the tamandua, if you had a scope, you could try intubating them that way. You would just need a very long endotracheal tube because you probably have about this much length in order to reach the glottis and then be able to go into the trachea. So for nutrition in the wild, these guys are arboreal, so they tend to go more the arboreal ants and insects. They also eat a mixture of fruits. They also could eat potentially some protein sources like some chicks or anything, because I've seen them in captivity really liking pinkies. And I think we're still learning more about what is their diet as we try to do some more nutrition studies. In captivity, the diets can vary. For the most part, most of us tend to use the commercial insectivores, something like the insectivore diet from Missouri. And I know there's a couple other manufacturers for their own insectivore diet. Obviously, this differs from like the US versus Central and South America versus Europe. At times, sometimes they get supplemented with fruit, live foods. They sometimes do like the crickets or pinkies and vegetables. You just have to be really careful with the fruits because these guys can be prone to diabetes. So you want to make sure you're not giving them too much sugar. Another type of diet that has been used has been like a mixture of sort of like your dry dog food mixed with like an omnivore biscuit, sometimes mixed with cat food, occasionally meat-based diets. So I've used the meat-based more for those tamanduas that weren't eating. I've sometimes done the commercial Hills AD, which is a high calorie, high protein, high fat, and that sometimes has triggered them to start eating. At times, we've also tried the feline carnivore, the feline diet from Toronto. The one thing for those, it's if they are meat parts like tendon, you have to be really good about straining because any bits of tendon could end up leading to sort of like a tongue constriction. And then you have additional problems with that. And then I know for enrichment, we sometimes do give them yogurt or some dairy products. I know Felice loved it. The one thing is just being cautious as to what type of yogurt you give. Don't give something that has high calcium and high vitamin D, which most of the human products do, because it's helpful for us. But for these guys, they're very sensitive to high calcium, high vitamin D diets, and it can lead to other problems. And then if you need to use it, sort of try to use it sparingly. So nutrition-wise, in terms of giving any supplements, so these guys do require vitamin K. And the values that I have are sort of the values that have been published around. One of the things is that some of your commercial diets, they are starting to supplement more and more with vitamin K and taurine and even vitamin C. So you might end up needing to adjust those. Because I found out in one of our tamanduas was that whenever I tried to get blood, the blood was clotting super fast, and I just ended up backing down on the vitamin K. Obviously, if your animal is sick, it's something that you might need to go a little bit higher on your dosing. And then like anteaters, you need taurine. And then the vitamin C, I put a question mark because we really don't know. There's actually been a couple of cases of scurvy or hypovitaminosis C. One was a case of a neonate, and it was seen on histopathology. So then there's a question, because that's different from the requirements from Giant Anteater, as to do they need it or not. So it's just something worth noting. And I know some of the diets have added it for just in case. So for your reproductive anatomy, the males, one big thing is the testes are in the caudal abdomen. So if you're doing an ultrasound and you see two little round soft tissue structures by the bladder, most likely testes, especially if it's a male. And then the sperm has this oval head, central insertion tail, if you ever had to see it. And then the females, just like anteaters, and that's why I have a photo of anteaters, because that's the one that I had. So they have a primitive divided uterus. They have a hemochorial placentation. So I just put the difference between an anteater and a tamandua in terms of their average estrus cycle. Anteaters are about 45 to 56 days. Tamanduas are just a little bit shorter, and they're polyestrous. And then the one thing just for you guys to know is that sometimes it has been noted in tamanduas that they have this noticeable vulvar bleeding, and it's more than you tend to see in giant anteaters. And there was actually a study by Kusuda et al. That they saw vulvar bleeding at the time that your progesterone was decreasing, and then that length of vulvar bleeding could be up to 43 days. I think I've seen it less than that, but in their cases, it went up to 43. And then the timing from when your bleeding starts to the peak of estrogen was about 23 days. So this could actually help you in terms of when you want to put your males in for pairing. And then this is just a little bit of anatomy of your ovaries, your little uterus and bladder, which is helpful when you're doing ultrasounds and trying to picture what you're seeing. And then this is a photo of what the placenta looks like, the outer part, and then this is where the fetus goes and attaches. So gestation in anteaters, we know it's 190 days. In tamanduas, it's been more about 130 to 150 days. Twinning is rare. I've heard it more with giant anteaters than tamanduas. And then the one thing is that you can see breeding during pregnancy. So you can't rely on that to be like, oh, they're breeding, they're not pregnant. I would say they might be. So that's why it's always good to look at other methods to diagnose your pregnancy. These guys are fairly easy to ultrasound, so I always say do your ultrasound. So at Nashville, what we did was that once we put the male together, the keepers told us when we were about 6 weeks, and we started doing ultrasounds every 4 weeks until we found a pregnancy. And then we could adjust it whether it was rechecking the ultrasound every 2 weeks to 1 month, depending on the tamandua. You can also look at blood or urine progesterone levels, and there are papers that give you some of those normals. But some of these levels can vary, particularly the progesterone. When you go from having progesterone being secreted by the dam and then being more by the fetus, there's like a little bit of a drop, so it could give you like a weird value. And then radiographs, like I mentioned before, obviously is more late-term gestation when you have more of a skeleton, mineralized skeleton that you can see. That can also be helpful. And then my one recommendation, given the problems that we see on these guys in terms of stillbirths and problems delivering or survivability of the fetus, it's If you diagnose a pregnancy, please continue to monitor because we're still trying to figure out for some of the giant anteaters and the tamanduas, sometimes they tend to lose the fetus midterm, and we're trying to figure out why. And then having that information is going to be helpful. And then this is actually for giant anteaters, so don't write these chest girth numbers because tamanduas are way smaller. There's actually a paper done with very similar values, just obviously smaller centimeters for their heart girth, but this was a growth curve that you can use when doing ultrasound. So you measure the heart girth, and at each point in time, you can get an estimate. And we had done several anteaters, and I would say anteaters that we did afterwards pretty much follow this one. And if you look at the Thompson et al. Paper, you can actually find the diagram. This one was just cooler because it was more colorful, so I liked it. And it shows it a little bit better. And then, so for parturition, so the ideal case is that your tamandua pup is born. So for them, I would say I've sometimes seen them present breech, other times normal. Most often they are pretty bright and alert. They are not like this guy that reminds me a little bit of Schmeagle, but they're fully furred and they're very strong, and they grip to mom's tail or foot and latch on. When you don't see that, you start worrying about, did it come in a little bit too early, like in the case of this one? So are they premature? Is something else going on? Is the dam taking care of them? The dam should allow them to crawl over and nurse. If they don't, you have to keep an eye that the dam doesn't start trying to claw the baby. I've definitely seen cases where the mom starts sort of grabbing, and then they can actually puncture into the chest or abdomen of the pup. In the event that you need to hand rear, there are different types of milks that you can use. KMR has been used before, as well as Asbelac. Obviously, these guys do need to have taurine and vitamin K. I've also used the Zoologic Matrix, the 3060, which tended to have a little bit more fat, and it seemed to help them have less constipation. For these guys, they do tend to defecate every 3 to 7 days. So don't freak out if they don't defecate every day, because I learned that lesson the first time. And then problems to watch out for are pneumonia and then just constipation. And these guys are immunocompromised if you're hand rearing them. So you just have to take proper precautions. So in 2016, I conducted a mortality survey across for Southern Tamanduas held in North American HCA institutions, and currently trying to update all that information because we've had some changes. So for these guys, there were about 64 Tamandua deaths over that time period. And the distribution was a little bit even. You had obviously more adults, but interestingly enough, I still had a high percentage in juveniles, and a lot of these guys were because of stillbirths or dying within the first couple of weeks. So this is an overall morbidity summary, and because of the adults, you see a lot of degenerative diseases, and that can be like arthritis. They had a lot of degenerative heart disease. So think your small dogs with your mitral valve, and that's why they tended to have, which is a little bit different from what we tended to see in giant anteaters with the dilated cardiomyopathy. We did have an increasing number of endocrine diseases, particularly diabetes. And then now we're starting to see a hypercalcemia that we don't know if it's endocrine or nutritional. You did have a huge chunk of infectious, both in your juveniles as well as your subadults and early adulthood. And then your reproductive disease was a lot were because of stillbirths or if the dam had any issues with parturition. So for the top morbidities, the neonates had reproductive disorders, and that went with the stillbirths. And they were also prone to a lot of infectious diseases, particularly the lungs. If you think tamanduas and what is their nemesis in infectious, think GI and lungs. For your subadults, infectious, same thing too. And then your adults, you had more of that degenerative disease in terms of your heart diseases, osteoarthritis, and then just old animal changes. And then you also saw some neoplasias for that. Now, one of the interesting thing is that some of the problems we've seen, like renal disease, that goes across from juveniles to subadults to adults. The same thing goes with the hypercalcemia. So like I mentioned, infectious diseases, lungs. So that's a photo of a pneumonia in a Tamandua, unfortunately. Your Tamandua kids that are newly imported, they're very high risk because they're immunocompromised. And then usually these guys can get pneumonias, they can get enteritis, so infections within their gut, hepatitis, so liver, or encephalitis with your nervous system. And then, like I mentioned, your neonates are high risk for pneumonia. And for these guys, I would say if you're treating a bacterial and you're starting them an antibiotic, make sure you're giving them the adequate amount of vitamin K and that you're covering for that, because that can actually exacerbate your changes in the DIC or disseminated intravascular coagulopathy, where they tend to have more of a bleeding disorder. And these guys are set up for getting sepsis as well. So if you have pneumonia case, good thing is treatments are just the same as dog and cats. So mainstay is antibiotics, supportive care. They're very great for nebulizations, as demonstrated by the little mascot that I had, but we did it for several tamanduas and anteaters, and then nutrition is key for that. And then obviously these guys can get parasites depending on where they are, and then they can get tapeworms, your nematodes, protozoal. I definitely seen several cases of Clostridial disease. So if you see bloody jam-like stool, take a sample and make sure it's not Clostridial infection. And then these guys can get mites, ticks, and fleas just like anyone else. So for your infectious diseases, there have been cases of influenza that could affect them as well as giant anteaters. The stemper, like I mentioned before, there's been several papers where they've noted cases of the stemper in giant anteaters, and Tamandua should be similarly susceptible. And then, like I mentioned too, the rabies. And then for SARS-CoV-2, now in the age of post-COVID, there was actually a recent paper where they saw positive SARS-CoV-2 in a giant anteater. So, and then based on some other studies in terms of the ACE inhibitors, it definitely, they could be prone to it. So just make sure you're taking proper precautions. And then for those places that have vaccines accessible, they might be one of the species that you might consider vaccinating. For non-infectious, the big ones that we tend to see is trauma. And the big plays that they have trauma tends to be tongue constrictions. I've seen tongue constrictions from tendons, from root balls. I sometimes don't know how they do it in the wild, but they seem to get their tongues stuck in places they shouldn't. And even making sure in some of your drains, I've heard some cases where one decided to stick the tongue where it shouldn't, and then the tongue got amputated. They can also get claw and tail injuries, and then they also get the degenerative heart disease when they're older, and then they can also eat inappropriate things and get foreign bodies. And then kidney disease is probably one of the biggest nemesis, and it's something that I've been seeing more cases, at least based on consults, and it's something that we're still trying to figure out. Why is it that we're seeing it at all ages? And then, like I mentioned before, diabetes, and then this hypercalcemia, whether it's an endocrine, nutritional, or does it come secondary from renal disease, we still don't know. And then they can have bleeding and DIC if they don't have proper amount of vitamin K. So when I'm talking a little bit about the hypercalcemia, there's another disorder that looks very similar on radiographs, and that's hypervitaminosis A. And that is something that's been described, that was described by Cronshaw and Oyarson in 1996. And it definitely was seen earlier in the 2000s. And then as our diets improved, it sort of gone down. And clinical signs is we see this hyperostosis. So you see this sort of almost fusions of the thoracolumbar spine. You do see soft tissue mineralizations, and then the way to diagnose it is looking at your radiographs, and then you need a vitamin A liver sample in order to check the values, and then those values tend to be elevated. And these were the values that they saw on their paper. When we see some of the issues with hypercalcemia, some of the clinical signs are very similar to that. And for the hypercalcemia, one of the things that we've seen is that in some of the cases, we're seeing at least suspect increased vitamin D3 levels. We're still trying to do a couple of studies and trying to figure out what are the best testing. We do see increased total calciums. And here I put sort of a greater than 12, and that's based on some of the normal animals and values that we had on apparently normal tamanduas, and then seeing those affected, and it seemed like 12 and a half was a cutoff. We need some wild animal studies in order to know what is normal, because that's been one of the problems that we have with tamanduas as well as giant anteaters. It's what is normal taurine, what is normal calcium, what is normal vitamin D, and more studies have to be done in that realm. For these guys, you sometimes might see calcinosis cutiae, and I actually have a photo on the next slide where I can show you. Here, I'll show that one. So you just have like a little sequestrum that when you send it out for biopsy, there's definitely calcium deposits. On your physical exam, you might actually see something in the eye. So this was corneal mineralization. And this tamandua, I think, had a calcium of 16, also had renal disease on top of that. And then one other way to see your mineralizations are your x-rays. So in this particular case, it's a great anatomical study, but pretty much all the great vessels, as well as some of the smaller ones. So you can see the aorta going over here, and then you have the little vessels going over there. All of this was mineralized. Also, if you see the spine, you see extra mineralization or hyperostosis here. On your long bones, you might see thickening. You can also see mineralizations in the kidney, as here, or sometimes you might see sub-Q deposits as well. And then this was a different case where pretty much all around the salivary glands were mineralized. And then here you can actually see the thickening of the humerus as well. And then you also see mineralizations of the bronchi. And it's something that we see it progressing. And then these are just VDs where you see it is not, this was a little bit earlier, but you see a little bit here in the subcutaneous space as well. And another radiograph, just close up, you start seeing more mineralizations around the bronchi for that. If you do ultrasounds, you can actually pick up a lot of this mineralizations. So this is actually an image of a kidney, and this is sort of the ring around the pelvis. So it helps you in saying like, hey, where's my, or the medulla, sorry. So you can actually see the distinction, but it's probably not good that we see it. And then on histopathology, if you do a cross section, sometimes you might note very thickened cortex, and that's something that we appreciate on radiographs as well. And then what we see on radiographs and what we see on Rose necropsy, so you see arteriosclerosis in the great vessels, so all of this is hardened. And then we also see them on coronary vessels, and that's something that you are able to readily see on x-rays too. And obviously this causes secondary problems for the tamandua, because this can lead to heart disease. In the kidneys, you can get exacerbation of the kidney disease. So this was actually one of the cases we had at Nashville Zoo, Kesha, and she was about middle age. And over a period of time, we started somewhat normal, and then she started having increased calcium levels. And then we also did, we started doing a little bit of vitamin D levels, and we actually had some bank serum, so we were comparing. And then we sort of paired up with some of your kidney levels, because we definitely noticed that her BUN, so that's one of the markers that we use for renal function. Sometimes when you have increased BUN, it can also mean like a gastric ulcer. So if you have a GI bleed. And one thing in tamanduas, and I've seen it in a couple other ones, was that increased. But your creatinine, which is the other one that we use to evaluate kidney disease or kidney function, seemed to stay static. And that was something that I noticed. I think I had a case, and then a couple other places had cases that we noticed that it was more the BUN that was giving us more an indication that kidney disease was going on, more than that pairing with the creatinine. So unfortunately, we did have to euthanize when everything got so mineralized and she started to decompensate, but because of her kidney disease as well as other problems. So treatments, we don't have like a definitive treatments, but there's a lot of possibilities, and it's very similar to what we do for cats. So that's like biphosphates, you can try steroids or calcitonin. Obviously, each of these guys have side effects, and you just have to evaluate the case that you have and what works best for them. I've also had some cases that I've consulted where they've had severe hypercalcemia. We evaluated the diet and we were able to back down on the calcium and vitamin D level. And that did help to decrease some degree of the hypercalcemia that we saw, as well as the mineralization. So taurine deficiency is not as common as giant anteaters, but it's definitely been reported more in juveniles. And you might get like a little naked little baby tamandua. I actually did have that with the first case that we had, and we just had to up the amount of taurine, and that actually improved. These guys can get the dilated cardiomyopathy secondary from taurine deficiency. And there's definitely been cases in tamandua, so it's definitely something worth evaluating with your whole blood taurine levels, but it's just not as common. The one thing I found with these guys compared to your giant anteaters is that their whole blood taurine levels seem to go higher, so they were more in the range of 300 to 600 versus your anteaters that usually you wanted them above like that 200 250 level, and trying to get them up to 400 could be a little bit of a challenge. You had to supplement a lot, but it's something, again, we need to have some of those studies of what do wild tamandua normal taurine levels are in order to know where our actual normal range is. So for your gastrointestinal diseases, like I mentioned, kidneys and then gut are the two big ones. So these guys can be prone to inflammatory bowel disease, and both with IBD as well as the hypercalcemia, we are worried that we don't have the captive diet quite right. So are some of the things that we're seeing because of our nutrition or because of something else. So things that we see with IBD, as well as other types of GI problems, so even just inflammation like a gastroenteritis, is loose stool. They can have some straining, they can have diarrhea, they can actually start going off food, and weight loss. For tamanduas, just like giant anteaters, when they go off food completely, I try and start trying to figure out the whys, and also trying to find ways with supportive treatment in order to get them to restart eating. So the best way to diagnose if you have an IBD case is to scope them and get biopsies. And for these guys, most of the biopsies we've seen tended to be more of like a lymphoplasmacytic eosinophilic gastritis and enteritis, which just sometimes makes me wonder, like, could they have some allergic reaction, like an allergic disease to something in the diet that we're giving, or maybe that's just the way that they respond. And that's where we still have a lot of questions. Like I mentioned, doing like scoping, getting blood, working up your fecal, just the same ways that we do your dogs and cats. And then your treatment is just going to depend on the severity. In this particular case, they actually did give it some supportive feeding. And other times we've been able to tube them once. Just be careful not to get into the trachea and have them aspirate. But then also sometimes with your supportive care, like Serenias, famotidines, or metoclopramides, you're sometimes able to get them to start eating. And then reproductive disorders was something that we also saw both in the juveniles and the neonates because of the stillbirths, as well as some dams having problems. And we don't know, is it genetics? Is it something in our husbandry? Is it diet related? I've definitely sometimes seen some have a little bit more bleeding while they're pregnant, and I start worrying about what that means for the fetus. Usually for those cases, I might start increasing vitamin K, also doing those frequent ultrasounds on making sure that the fetus is doing right. And that's where your ultrasound monitoring. So if you have a Tamandua that's trained for that, that's awesome, because that gives you so much information. And then we as vets can act and give better supportive care. So that was the whirlwind, because I probably went a little bit too fast. So where are we now? So there's a lot of questions with a lot of diseases. So right now I'm sort of in the midst of contacting a lot of the North American HCA zoos, now that SIMS has done, has helped a lot with the SIMS sharing, and just sort of getting like an updated mortality study. A lot is that over the past 5 years, I've definitely heard more cases of hypercalcemia than I did before. And it's something that on my previous data, I started seeing the hypercalcemia sort of starting to creep out more in that mid 2000s range. I know in talking with Missouri, they've done an awesome job where they've actually decreased the amount of calcium and vitamin D. And that's one of the things that I wanted to see more, like, has that helped as we get the newer generations? And a lot too is trying to do some of the studies out in the wild in order to know what is normal for them. That's also my hope for giant anteaters, because the more we know, the more we know of what normal is for them versus saying, oh, they're like a dog or a cat, the better it is that we can tailor our nutrition, we can tailor also our supportive care, and where do we need to have them with. So they're definitely challenging, but it's something that we're still learning a lot. And I always value anyone has questions or any thoughts or ideas. I'm always open for that. So for that, thank you so much. And then after Kenny talks, I'm free to take questions.
This webinar is part of the International Union of Conservation of Nature, the SSC, Anteater Sloth Armadillo Specialist Group. Our website is xenarthrans.org, and we have a pretty active Instagram and Facebook social media pages, as well as YouTube. So on YouTube, we have been publishing all of the past webinars there, as well as Facebook, as long as the webinars are under an hour. And if you care for anteaters, sloths or armadillos, and if you have pictures of them that you think we could share, please send me a message on one of those platforms, or you can email me and I would be happy to post them. If you go to xenarthrans.org, you will see that we have some fact sheets for every species in the Xenarthran group, which is, like I said, armadillos, sloths, and anteaters. We have a yearly newsletter. We have scientific papers published, and we also have a little education corner. So in the past couple of months, so far I've published 3 animated videos. One of them is on sloths, one of them is on anteaters, and one of them is on armadillos. All 3 videos are available in English, Spanish, and Brazilian. Probably tomorrow, there will be another 4th animated video about the past, present, and future of Xenarthran. So we're going to be talking about megafauna from tens of thousands of years ago. So I'm excited to publish that animation. Along with the animations, we have activity sheets for elementary and middle school students. We have coloring sheets, spot the difference, mazes, crossword puzzles, word searches, and we want you as zoo educators or rehab facilities to use these free resources. So you're going to go to education, and then we have a little tab where you can download all of those worksheets for free. And once again, thank you, Dr. Margarita, for doing that wonderful webinar. We have a couple more scheduled in April and May. And if you know somebody who you think would make a great webinar, please send me a message and I would love to schedule them. Some of our webinars are in Portuguese, some of them are in Spanish, and some of them are in English, because the IUCN Anteater Sloth Armadillo group were mostly in Central and South America, because that is where they are native to. But we want to cater to everybody who takes care of them. So we're welcome to any language. If you feel inspired and you want to help conserve them, you can go to our website, xenarthrans.org, and hit the donation button. And that will allow us to fund different conservation projects in the future. And for our education component, like our monthly webinars, like those animated videos, like the worksheets, and in the next year, we'll be creating an interactive map where you can click on the countries and then of Central and South America, and then it's going to list all of the Xenarthrans there, and then there will be children friendly pages. Our two primary partner institutions are FIA, which is the Foundation for International Aid to Animals, and Nurtured by Nature. And with that, everybody who's attended live is welcome to type in questions in the bottom of the chat. All right, so Dr. Margarita, are you ready?
Yes, I started looking at some of them so I can start answering them.
Okay, so I'll read them for the people, because when we get posted on YouTube, they won't be able to see what the question is.
Okay, got it.
So for enrichment, I know zoos that have used avocado and honey and like see-through tubes to show the tongue action. So what do you think about that as a novel food?
Oh, they love avocados. So I would say both the giant anteaters and the tamanduas, sometimes even a little bit of hard-boiled eggs. Obviously, making sure, like if you have an animal with hypercalcemia, especially the eggs, just be careful with that. But like at Nashville, we used avocados, sometimes hard-boiled eggs, and then sometimes mixed with yogurt or an insectivore diet for training or trying to get them to station for ultrasound training or anything. So they love it. So I would say go ahead with the honeys, just like the fruit. Just make sure, especially if you have like an anteater that's having diabetes or anything, that you're not overdoing it with the sugar, but a little bit goes a long ways for them.
Do you have a longevity range for a healthy lifespan for a tamandua in captivity?
So at least in the study that I did, the oldest tamandua that we had in the records, at least I guess in my necropsy records, was 18. So usually I would say for them, they tend to be more like in your late teens. In giant anteaters, one of the oldest ones was more in the mid 30s. So it was, and I don't know if that's just like a normal species thing or, you know, like different species or anything. The one thing for tamanduas, and that's the reason that I'm trying to look a little bit about this kidney disease and the hypercalcemia, is that it's hitting also your super young animals. So even if they have mild cases and they start having kidney issues when they're 1 or 3, that definitely decreases their longevity.
Seeing the same mineralization in wild individuals, do you think, have we had the ability to compare? You kind of mentioned that at the end, but specifically for the mineralization, is it a captivity issue?
So right now we think it might be, at least I haven't heard of anything obvious, but I think we definitely need to do more studies. I know that there's a lot of groups that, you know, are evaluating sometimes samples from tamanduas or anteaters that they find dead, particularly like if they're killed like on the roads or anything. But I haven't heard anything about an increase or seeing it. I still suspect it might be captivity, whether it's linked with nutrition or something that we're doing. And that's where we need to find out. I'm also trying to find out, is it just that I'm hearing the harder cases and that's where I'm like, wow, it's prevalent. And that's the reason I'm redoing the mortality survey now to see where are we seeing it and what's the difference. Is it a, you know, more certain types of diet, or is it certain types of settings that we're having, or is it, you know, if there's some genetic component to it?
Very good. And that question was from Madison. The next question is from Jenny. With the slide with the foot, there was also a dark spot in addition to the calcium deposit. And we've had the same similar dark spots. Do you think it is due to the substrate, the flooring, the cement enclosure? And then we have a couple of people who agreed and are supporting that question. They've also seen some little dark spots, maybe on like the base of the tail or the pad of the foot.
Yeah. I know for ours, I sometimes saw some hyperpigmentation. I just pulled up the slide on my other screen and I'm trying to figure out, because some of it is I have the swelling, and then she also has a lot of food and leaf in there. I do remember Kesha having like a little pigmented area that was normal. I think it went part of the histopath that we took in there. I haven't seen any particularly like problems with it, but I would just say if you notice that the dark spot gets red, swollen, grows, definitely let your veterinarian know and then they can investigate it.
How do tamanduas or giant anteaters do in humid or moist enclosures? Are they okay with it, or would they do better dry?
No, they actually tend to do better with humid. So one of the problems we saw in our anteaters or tamanduas, particularly in the winter, when you have the heat and dryness, is they tend to get the cracked paws, their skin gets dry. They tend to sometimes have like a little bit brittle hair and everything. So they definitely need that humidity. So I think in a way they actually did better in terms of their skin conditions and everything more during the humid summers of Nashville than they did in the dry winters.
Becca asks, has there been any studies that linked the insectivore diet directly to any of the diseases?
So there hasn't been one complete. I've been talking with a couple of the companies. One time before we saw the hypercalcemia with some of the GI issues, I know that some of the problems we see here in the US are completely different from Europe or like in the UK when they use termite. So that's the question of, is there something food-based, like allergy-based for some of the gastrointestinal problems? Now for the hypercalcemia, so the PAG's Tag Nutrition Advisor, Heidi Bissell, I know several years back, she had done a mini study to see sort of like what was found in some of the stomachs of dead tamanduas in the wild. And one of the things that some of the invertebrates she found had like almost a reverse calcium phosphorus ratio, almost similar to what you see sometimes in some reptiles. So that's the question is, do they require less than what you think a typical mammal? I know when we were talking about diets for a long time ago with Missouri, they had evaluated, and since insectivore diet is not just for tamanduas and anteaters, sometimes it's primates is used. So it's animals with different needs. And there were some that they were supplementing more for the primates. They actually tried to make one for those insectivores that might require less. But that's one of the things with this mortality study that I'm currently doing, is trying to see the prevalence and trying to see from that and finding out what institutions have had the problems. Can we evaluate the diet, and is it something the same? And at least from the several cases that I've had throughout all these years, sometimes it's been different. At times I've been able to figure out diet where they were giving a lot of calcium supplementations because of the diet that they were being fed, and that was like an easy fix. So I think we're still on that early part, and it's just something that we do need some of those wild studies in order to know like what is normal for them. And it's something that's going to take multiple studies, because it's not just like, hey, let's take some blood. It's probably take blood, then find out, then we'll get way more questions again, and then continue. But it can be challenging because some countries it's hard to bring the blood back to the US. Some countries don't have the specialized labs, particularly for taurine level, where we can then even out what we see in captive settings versus in some of the tamanduas in South and Central America. So there's definitely some challenges in there. I'm hoping one day we can get it fixed or figured out at least.
You have a couple of comments that say, thank you so much for a fascinating talk. It was so interesting, brilliant talk. I learned so much. I imagine people will be replaying this and sharing it with their colleagues, and that's what we hope. And you just mentioned taurine deficiency. So Shane is asking, can you just elaborate a little bit more about the remedy or the treatment for taurine deficiency?
So for taurine, it's pretty easy fix. We just give them supplementation with taurine tablets. So you can actually buy the supplementation. I want to say it comes like in a gram tablet. For anteaters, I've usually gone 1 to 2 grams per day. But then when I've taken some of the blood, like if you take blood and run the whole blood taurine value, sorry. I've sometimes had to adjust whether they needed more or less. Same things for Tamandua. For the particular Tamandua pup that we had when he was a juvenile, I think I gave like 1/8 of a tablet and then sort of went from there. Obviously, I wasn't taking blood from the little guy that often, but I definitely saw the results in terms of his hair loss. It started to regrow back. And then when we were during one of his normal routine exams, we took blood and submitted it. So here in the US, I tend to send the taurine levels to UC Davis amino acid labs. They're probably my go-to lab for that particular one, where they've had their certain methods and it's been across the board. And you could do whole blood or plasma. The one thing for plasma is that if you have hemolysis, so a little bit breakdowns of those red blood cells, it can falsely increase your level. So I usually try to do the whole blood one because then I don't have to worry about all the other stuff for that. So yeah, so easy fix. Taurine helps just even I think GNC, I think we got it in Nashville. It was like, just go to the GNC or go to like the supermarket and you could buy it or order it from Amazon.
Madison asks, what is the recommendation for exams care post-partition? Like how long should we be hands-off versus when can we start handling the youngster?
So I think some of it depends on the type of Tamandua and what your setting is and how used to people they are. So for example, in Nashville, we had one Felice. The second time around, she was a better mom. Obviously, we first want to make sure that there's good care. For her, she was used to people. So once the pup, especially after 1 to 2 weeks, she was used to keepers sort of grabbing the pup to get weighed and make sure the pup was fine. And we can do very brief exams even after like first couple of days because she was used to us and she didn't care. And for her, if she got a cup of avocado or yogurt, that was better than taking care of the pup. She was also the first one. She was the one that had that preemie, and I would say as much as she was a good mom, the pup had to do a lot of work to cling to mom and tell mom what to do. We did have another one, Pisca, and she tended to be a little bit more standoffish, but she was trained enough that for treats or anything, she would focus and we could do brief exams for that. Watching how the pup is doing, if the pup is strong, if it's nursing, and that sort of tends to tell you if you have to intervene or not. If you find a pup on the ground cold, then you better grab it. That means the mom just sort of left it. The pup, both Tamandua pups as well as anteaters, they call a lot to mom when they're in distress or separated. So they're used to being on mom versus like, leave me alone. In the wild, there's sometimes are placed temporarily, like in the little, like say Tamanduas in the tree or anything, but it shouldn't be that long. And I would say for the healthy pups that we had, you could hear them when mom wasn't coming back and it's like, hey, come back over here. But for the most part, they should just be latched on mom. And if you don't, then definitely intervene for that. If you have Tamanduas that are not used to as much for you and they're doing fine, then you can be a little bit more hands-off. I think just in our case, they were used a little bit more to us, so we could do every couple of weeks. And the same thing was for the anteaters. We had some anteaters that were very much used to, and that's something that the keepers worked a lot in the trainings to get them desensitized, and they were able to sometimes be able to take like once a week or once every 2 weeks wait, so that we knew that the pups were growing appropriately.
Amanda asks, do you have any recommendations for pairing for breeding purposes? Do they need to be separated? Can they look at each other?
Can you repeat that one? Sorry, I was trying to find where it was.
It's the way at the bottom, pairing,
Oh, okay.
pairing for breeding purposes,
okay.
Suggestions.
So for those, and I would say if you contact the keepers at Nashville Zoo, because they did a lot of the intros and everything. And I think I also saw a couple of them here. Some of them have gone in different places, but usually you want to start doing your intros. So if you get a male and female, and you want them, usually just making sure that they get along with, usually starting with short bouts. You might see them sometimes tussle or anything, make sure there's no wounds. After a certain point, they start getting used to each other where they both sleep. Sometimes you can have them in the same stall and each of them might sleep in a different bucket or anything. So a lot is trying to put them and make sure they're compatible, that they're not injuring, that they're dealing okay with life. And then you're wanting to make sure that they're breeding. After a while, you start seeing the males. Obviously, if you have a very young male that might be inexperienced, he might not quite get it. But sometimes if you pair them with an experienced female, she helps them out. So, which I was like, okay. But a lot of it is just with the cause that they're not like trying to stand up and fight with each other and injuries, and that they can actually share the same housing. And I would say tamanduas, like actually both tamanduas and giant anteaters, they go through a little brief period, but for the most part their intros tend to do well. Obviously there are some individuals out there that don't like certain ones, so if you're not, you might need to back off in your training or in your pairing and go a little bit slower, or see if there's any stressors for that. But I would say for more information, if you want to reach out to, I can put people's emails, or if you want to, I'll put my email here for people, but I can get you in contact with the curator at Nashville. And I want to say they actually built a little manual for people, because that's a common question that was asked.
Mm-hmm. All right, well, very good. So you have about a handful of thank yous, excellent talk. I'm going to share this with my vet staff. And then Trevor did ask if you could share your contact information, which you just did. So thank you, Margarita Woc-Colburn. You're with the Phoenix Zoo now. So if you are a zoo professional, that is how you find her. Yeah,
you can find me in a lot of ways. So yeah. But I put my email, my Phoenix Zoo address here. So feel free to drop me a line. There's also, if there's any questions about other Xenarthrans, I also know who the other vet advisors are, or questions with nutrition, I can hook you up with a nutrition advisor too. So.
Very good. So thank you everyone who attended live. If you want to see more content like this, or if you have like a specific webinar idea, contact me. And then I'm going to probably contact Margarita, and then we will set it up. All right. So thank you, Margarita, and thank you everyone for joining us.
Thank you, everyone. Have a good night.